departments, the common disease is cancer. Yeah, so it's cancers in every department. I've seen, like in GIT, gastric cancer. When you go to any respiratory system, you go, you see lung cancer, a lot of cancers. And other thing I have seen is developed materials, equipments. They have advanced equipments. Yeah, so and I have been able to attend a lot of surgeries. They allow you to enter in the operation room. The doctors try to give you the brief of what is going on, and you go and study, and you come back again like that. So it has been good. It has been good. Yeah, and of course, as I'm ending my medical studies over here, MBBS, of course, I go home and get more topical diseases and know how to handle them. That is the thing I can talk about my experience. Yeah.
Okay, that's amazing. So, Nicholas, I do have a question for you. A lot of the students that are looking to come to China, they have a misconception that there is a major language barrier. So, doing your internship in China, how was the interaction between doctors and students? Were you able to communicate properly in terms of English using the English language?
Right. Oh, in the hospital I was in, it is first affiliated hospital to Hebei Health University. So every department has a representative of student, like a English doctor who can try to explain the cases. So when you go in the morning, they do the morning stuff of doctors. After morning stuff, then the doctor who is responsible for foreign student is the one we follow. So every question you have is the one to ask. Yeah, so that is the thing. So in every department there is that kind of so it is not of course it is not gonna be equal to my country. Yeah, because my country everybody speaks English, and you can ask anybody. Yeah, conversation is too advanced, but here is only one person, and like that. So it is not too bad. Yeah, it's good, like as I have seen it.
All right.
Yeah.
Okay, so from what I perceive is that you didn't have any major difficulties doing your internship in China.
Yeah, not much. Like yeah, major like complications. Like maybe they could. There are some cases that need a lot of explanations. Like maybe surgery cases. Yeah, as I said, some cancers. So what the doctor will tell me, we explain, give me the brief, and then tell me to go and read more about it. So that's the thing. Yeah.
Amazing. Okay, Isaac, a lot of the students, when they come to study in China, they believe that they cannot go home for rotations or internships. So, do you have anything to say about that?
All right. It's quite easier to go home where you're coming from. You will just be treated as an international medical student or an international medical graduate. Um, all you have to do is to contact hospital, the hospital you intend to go to, right? You contact them, you get letters from the school introducing you as a medical student of their school. So it's basically like an introductory letter, and you can just go to the hospital's admission office or administrations and inform them. They would rather give you some days. For example, my experience, I went to my hospital has a postgraduate department that takes students, so they train both undergraduates and even those going through residency training. And so when